Couple of minutes before we get going to see if somebody else shows up. Does anybody else want to call in anything? Nicole, do you know?
I have not heard from Leota or Robbie.
Robbie won't be here.
Still
Okay.
gone, I think.
Okay.
For a while.
There's a strong possibility that Leota would not show up, but,
Hello.
hit the red button, he's
Oh,
muted.
push the button. It came on green when
Oh,
I picked
mute.
it up.
There you
There.
go.
Can you hear us now?
Yeah,
Is that you, Sean?
this is Sean, yeah.
Yeah.
This is the Board of Health meeting.
Yeah, Sean. Mike was just saying that we're just going to wait a couple minutes for more people to see if they're going to show. We just now have a quorum.
If someone emailed, Helen's email though, we would not have seen it.
So Leota just called,
Okay.
and she doesn't know how to call in.
Who?
Leota? Leota? Is that her name, right?
Yeah.
So if someone could call her or call her in, I have her cell phone number.
Okay. I'll just call her on my cell phone and stick her next to a microphone.
Okay.
Thank you.
Thanks.
Because I don't know how to conference on that one. Hi, Leota, Nicole Brown in the Board of Health meeting. I'm calling you from my cell phone, and I'm just going to put you on speaker near a microphone, if that's okay. Okay? Perfect. Okay, thank you. Just make sure this.
You see that gavel? Would you? Do I hit the gavel?
Oh.
I did not. All right, we'll call this meeting of the Broadwater County Health Board to order. First off, is there any public comment? No comment. So we will go to, where did Teresa go to? I guess we'll go to Sean first. Sean, do you have any COVID updates?
Yeah, I have a couple of things that I wanted to talk about. One, of course, is that the Governor Gianforte, basically rescinded the previous governor's directive, and then implemented his own directive. And that directive then took away, or by rescinding the other two directives, as we kind of talked, the commissioners and I talked about how that then took away all the guidance that we had, because it was all based on those executive orders. And so one of the questions I wanted to bring forward to the Board of Health is, I felt like I needed to at least bring it up, is do we want to be considering anything more stringent than what the governor has indicated, which right now is that, we'll be with masks until the vulnerable population is vaccinated. At that point, he'll hopefully, in his mind, he'll rescind any of the mask mandate, and then the rest of it just kind of comes down to like public gatherings. He just says follow the CDC social distancing guidelines, and the schools basically saying, everything is going to come down to us taking it on we as individuals taking it on ourselves, taking personal responsibility. Sorry, is the word I was looking for. So, so I'm not asking the board, or I'm not saying that I feel like we need to be more stringent, but if we do want to think about, if you as the board think that we need to be more stringent, I feel like we need to make sure that we get information out to the public. We will want to have a public hearing specifically for that and be prepared to do that. So that is one thing that I wanted to bring up.
So Sean, gatherings are allowed unlimited as long as you maintain social distance, is that correct?
And wear masks, yeah.
And wear a mask, okay.
That's what it's. And, businesses then are just kind of told to try to follow those guidelines of social distancing, doing temperature checks, testing, contact tracing, disinfection, teleworking, that type of thing.
Okay.
And So if you guys don't feel like we need to be more stringent than the governor's directive, I do want to ask what we're going to do. Right now, we have in place and it was based on the other directives by Governor Bullock, was, that if you're going to have a group meeting of more than 25 people, his directive said that you worked with the local health department. So right now, that isn't what is stated. But I still am getting a couple calls. Like, I have Vigilante Electric Co-op wants to hold a meeting in March at the irrigation supply, their catering facility there. And sorry, it's not the irrigation supply, but
At Watson's?
yes, thank you, boy. So Watson's, facility, so they want to have that, and they're wondering what they need to do that. And so right now, it just says under public gatherings that they have to do CDC social distancing and follow those. Does anyone read into that we need to be the ones reviewing and or basically enforcing that social distancing guideline? Because what that means is then we would continue to review these types of activities, and I feel like I need to know if I'm passing those on, or if I'm telling people, as long as you follow the social distancing guidelines, you can move forward with your event.
So do you have any idea how many people they're proposing to be at that meeting?
At the Watson irrigation, or at the Watson facility, the co-op said that there'd be at least 100 people there, is my understanding.
Is that capacities, is that something that they can handle still social distancing, or?
That's something, that I haven't even, I don't know how that facility, I've never seen it set up. I think they did have the Trouts Unlimited event there recently, and so if any of you were there, maybe you can give me some thought. I mean, so this is where it comes down to, like, if you want me to vet the situation and decide if it's even doable with what they're trying to do, I can do that. I just don't want to step over my bounds, based on what this guidance tells us we can do.
Okay. What does the board think we want to do with the governor's directive?
Well, Mr. Chairman, the governor has his directive of other counties that border us, Lewis and Clark to the north, and to the south is Gallatin. Both of those counties have elected to stay with their current directives and not honor or not go with the governor's of letting up on some of the directives. I think we're we're at a point with this thing where we're starting to see some leveling off of cases. I was just following this last week. We had almost a daily average of 800 people that were coming down with this. Since Saturday, it dropped to 425 with 2 deaths. The weeks before, there was like 8 daily deaths. Sunday, it dropped to 341 with 4 deaths. Monday, we had 178 with 1 death. And yesterday, it went up to 295 cases, but with 0 deaths. And to letten up, I know we are all sick and tired of wearing these masks, but you take people like Teresa that's been working endlessly, and to kind of, I don't want to say thumb our nose, or the county thumb our nose at the work that's been done. I just don't think we can if we can wait another month, see how this is going to go. The Watson project is a month away. We'll have another meeting before then. But I think as a board, we need to keep giving directive to Sean and to Teresa that with their support, they're out there busting their heinies. And the other thing that plays part in today is we have a new president that, as I only heard on the news, that is going to make the kind of tighten it up again, a little stricter things. I hate to see us lessen things today, only tomorrow that we have a presidential mandate that says we need to tighten them up even more, and that just throws the public kind of into what the heck's going on. All of us have been losing sleep over the COVID deal. That's the biggest thing that's hit this health board, I think, for a long time. And I know every one of us have had phone calls from the public that it's, masks are garbage and we're not doing enough on one side. And I think about the plague and that the community of Elkhorn had, and ask those people that were losing half of their family one day and the other half the next day if a mask would have helped them prevent their deaths. I bet dang well they would have been wearing their mask. And I just think we should stick with what we got. That's my thought right now. We've been working hard, and we're starting to see some things level off. Teresa's been, vaccines are going into place. The problem we have with this virus is, the good news is a lot of people haven't got real sick. The bad news is a lot of people haven't got real sick. And if we had something like the plague, we'd be pushing for it if it was as simple as wearing a mask. Teresa, how many cases of flu do we have going on? Still zero? Masks are working, social distancing working. I was in Town Pump the other day, and the manager there was stocking the shelves. A guy came in, and the manager very politely said to him, "Would you mind wearing a mask?" And the guy just cold stared at him, and he says, "Next time you come in, would you wear a mask? I have 3 employees out. That's why I am here." And I thought, that's the reality. And I hear this thing about, the essential jobs. Well, gosh, if your job depends on bringing home the family's dinner for the night, it's pretty doggone essential to me. I know I'm on a rant with this right now, but I got a phone call the other night, and it's just like, somehow we're not getting the message around to some people that masks don't work, and it's frustrating to me. I had a message from the hospital from St. Pete's on Sunday to all providers: if you can titrate down your oxygen, people, do so. We're low on oxygen. We don't see that in the news. Tried to send a patient to Bozeman. They wouldn't take him because they were full. I mean, we're in a bubble here. Anyway, I didn't mean to go on a tangent there, but
That's all right.
I want to say
So Dwight, thank you for those comments. But one of the things that I'd like to say is that we did not adopt rules stricter than the governor's. When the governor came out with his directive, at one point very early on in the COVID pandemic, like in March, the Board of Health adopted the mask requirement. And then once the state caught up to where we were, we adopted the state guidelines. And so we currently don't have any guidelines that are stricter than what the governor's directives are. And so unlike Lewis and Clark County, where their Board of Health did adopt stricter regulations, same with Gallatin County, they did adopt those. So right now we don't have those adopted, and that's where early in my conversation I was asking, do we need to do that? However, there is perhaps an opportunity to look at this portion of the public gatherings and say, we just need to make sure that you're accommodating the CDC social distancing guidelines, and we could continue reviewing events. But that's something that I need to know from the board, if that's the direction that we feel comfortable about doing, that we have the authority to do that.
You got anything, Debbie?
So Dwight, what would you like to see different than the governor's? 'Cause the
Well, I
governor-
forgot, Sean's absolutely right. You know, I was thinking that we were higher than what the governor had, but we are on the same, we're lower than the other counties to the south. And I guess I wouldn't want to see it lessen, and I don't think we can only go above that. Is that right, Sean? We can't lessen
We
the
can only be
stricter, yeah.
Right, we can only be stricter than.
So, you know, I guess. I guess the status quo is about where we're at.
I'm
Yeah.
asking, I don't know.
Yeah, I mean, yeah. You know, it's really tough to go stricter. I just hope we don't go the other way. You know.
So for events at Watson's, and I've been there and they've had 300 people, and I've been there, they've had 80. So I think they could maintain the 6 feet social distancing and have about 100 in that case. I don't know where their occupancy is.
So would we still want to, do we still want to review applications for events, or do we even have the right to request or require that?
Sean,
I
do
guess
you?
my thought is that we could say that it is our desire to review those events, and I can reach out to Corey in the meantime, and we could, if he says no, we really don't have the authority to do that, we'll just, I'll come up with a sheet that I'll, disseminate when they call and ask me. They'll say, can we do this event? I'll say, that's really not something we review anymore, but here's what you need to try to accomplish. This is what those CDC social distancing guidelines are about. A handout. So I can definitely do that. But I think, I definitely am not the one that can tell you whether we have the authority to do this or not. But I can reach out to Corey and find out.
Okay.
And as far as the mask right now, the governor is saying mask all the time, right?
Yeah.
Okay.
Yep. The
Okay.
statewide mask mandate remains in effect.
Yeah.
Yep.
So have we adopted the CDC guidelines, Sean? Is that what we're going off of?
I think that that's what the governor is relying on, is the CDC guidelines. They tend to, somewhere in the actual executive order, it talks about the CDC.
I thought we were going off of Bullock's things from, I didn't know there was a change. Or maybe Bullock's was the CDC's. I don't know.
Well, we were going off the bullets, right, but
Yeah.
then Gianforte
Yeah,
rescinded those, Governor Gianforte did, and so now we're following his new executive order. I'm just trying to glance through it. Doesn't really say. I mean, it just says any public gatherings or events should be managed in a way that accommodates CDC social distancing guidelines.
Well, I think as long as we have masks in place and social distancing, I don't know what else we can really do as far as any enforcement goes on anything. And that's pretty much what we've been going on is that and the CDC guidelines. So I think that we would want to stay with the way that we're operating right now. And
Okay.
by having groups check with us or check with Sean with a plan.
Yeah, I think we still want to have those plans
Yeah,
reviewed. 'Cause we
I do
don't wanna-
too.
And like I said, when Biden makes his decision of what he's gonna do there, if he's gonna clamp down, then we'll have to follow that. But I don't see much sense in changing everything right now until we figure out what Biden's gonna, when he comes out with a statement of what he wants to do.
I agree.
I think we should just stay with where we're at until then.
I would agree with that.
Okay, yeah, no, I think that, and you know, because a lot of times these are also associated with a business. There's a whole business section that says that they should follow these, a lot of the guidance, like social distancing, temperature checks, testing. So a lot of the stuff that we would have checked or would have had them doing as part of their event, we'll just continue to follow that. Yep. Okay. So we'll just keep going, doing things the way that we're doing. I mean, we have yet to, other than the rodeo, which was very early on in the fair, you know, and there were other issues that were related to that, but almost every event that has been brought forward to us, we were able to come up with a solution or help them come up with a solution so that those events could occur. And I think that typically those events went off the way that they should have. So, and I know Debbie was very involved with multiple of these events. So I think that she can maybe speak to the fact that typically it's the process is it may be a little arduous in terms of just you're always trying to figure out if you have approval, it's never been too difficult or stopped the event.
Okay. So I guess I'll entertain a motion to maintain the masking requirements, social distancing requirements, and to follow the CDC guidelines as they are at present.
So moved.
Well, Mike, I don't know that you need to do that because that's already, I think that was.
It's already
Okay.
covered?
That's already in the governor's, it's in the governor's directive.
Okay.
And I would hate to then, if they come up with a new directive, that then we would have to make our changes if we're just really referencing the governor's directives.
Okay.
Does everyone agree that, I mean,
That sounds good to me.
You know, once again, I'm not an attorney.
So let's see, vaccine distribution update. What do you have, Teresa?
Right now, we are,
You're gonna have to, you need to come up, I can't hear a word you're saying. I'm deaf.
me too. So right now, we've given out 100 of the 1A. Found out that the hospital was allocated the 100 doses for Broadwater County, which I had ordered, and so they're going to use 30 of those doses for their residents and for other staff members that haven't been vaccinated, and then the other 70 is going to go to public health. Our hope is that we're going to get 100 doses a week, but wouldn't sell the farm on that. We were supposed to get 6,700 doses in Montana for this week, and we only got 6,000. So that's where we are distribution-wise. We have started phase 1B as of today. So we'll continue with that, and have an article going in the paper on Friday. Gives a lot of information. As I said, our phone is just ringing off the hook with, you know, people are calling 3 and 4 times now to see if they're still on the list. when their name's coming up on the list, and we just don't have an answer for them. Because Lewis and Clark, had their sign-up thing, and then they had their thing out at the fairgrounds, people are aware that 1B has started, and they just want to know why it hasn't started here. And so I think the article in the paper Friday will kind of explain that a little bit. So we can only give as many vaccines as we have. And so I know that we have upwards of probably 350 people, and that's probably a little on the short side, people signed up. And that's not even, that is only 1B and 1C. We aren't even taking sign-ups for phase 2. It's impossible. So as soon as we get the vaccine, we schedule them within a couple days and try to just keep going down the list and trying to get everybody vaccinated. A lot of people are wondering why we're not doing what Lewis and Clark is doing. And number one, because we don't have the staff to do that. This is Broadwater County. Lewis and Clark has, the backing of, hundreds of people to be able to pull off an event like they pull off at the fairgrounds. We don't have that kind of staffing. We don't have that kind of volunteers. We just don't have the capability of doing that when we only get 100 doses. If they told me tomorrow I was going to get 900 doses, I would do my best to have an event like that. But when you only get 100 doses, it's not even worth having an event like that. So, and I know some of you have been, to my trainings where we talk about point of dispensing, which I've been trained by the CDC to do, and that's basically what they're doing. So I've been trained to do that, but with 100 doses, it's just a waste of time. Every person has to be there for 15 minutes. We can do 3 or 4 people every 15 minutes in our office, and to try to bring 50 people together to do 100 doses just isn't worth it. So, but at any point, if they say you're going to get 500 doses, then I would probably try to pull off an event like that. But that's what I need people to know, because a lot of people are calling in and saying, why can't we do what Lewis and Clark does? Well, they get 900 doses and we get 100. So, and I mean, it only took us maybe 2.5 hours this morning to do 20 doses right in our office. So, we can do 100 in a couple of days. So that's where we are with that.
So do I understand right that next week you expect to give out 100?
Well,
That's
I
the goal.
ordered 100.
Okay.
So let's just put it
Right.
that way. They're hoping that our allocation will be 100 doses a week, but there's no promises, because that's how much they order. The state orders, but that doesn't always mean that's what we're going to get. And so when Gianforte changed the age, the state told us basically, they had a plan, and when he changed the age just from 75 to 70, the state said we only have ordered half of the amount of doses that we need. And those are doses that go all the way to the CDC. And so there really isn't any way they can change that at this point. So everything is just going to be a little slower than they anticipated. So
I guess my question was, so if you get 100 next week, fingers crossed,
Mhm.
you have the staff and the time to give out 100?
we
that
are
was-
short-staffed, but like I said, this morning we pulled it off with no problem. So don't get anything else done, but at least we get the vaccines done. So
Well, I think if you got 700 doses, and they asked for some volunteers, I bet you'd get them.
Yeah.
You know,
And the hospital, we've been having meetings with them. We plan to have another meeting at least, maybe this week, at least by next week. So we can kind of join forces and they can start giving some of those vaccines over there as well. So we're working on a plan. We just, when we only get 100 doses, it's just not, feasible to get a big event going, so.
Debbie, I think too, to remember in the vaccine world, that the 2 vaccines that are out there came out pretty quick.
Right.
And in their defense, the Pfizer's has to keep, 80 below and things. And they only stockpiled so much because they didn't know whether or not they were going to get approved or not. So now that they've been approved, those guys, it's competition. They're churning those vaccines out as fast as they can. Doesn't matter if we order, 10 million of them, we're only going to get so many. But as those vaccines come up more, we're going to see more. AstraZeneca was supposed to be okayed a week ago Friday. They're like 10 days out from getting their final okay for the 2 months trial. I don't know why we haven't got them, but I bet you, they have been stockpiling too, hoping that is going to come on. That's a 2-shot deal also. And then early next month in February, Johnson & Johnson's hoping to have theirs out. They'll have finished their 2 month, and that's a 1-shot. So you add those other 2 companies throwing out vaccine to us, hopefully we're going to see that. I think we're ahead of schedule. I've been optimistic about it. I learned this morning I had a patient call and she'd already been over to see Teresa. It's like, whoa, that's great, and to have the volume, it doesn't sound like much, but it's a start. And I am not a COVID expert, but, I look at Fauci, and this is his first go-around at this thing, too. We're all in this thing. It is, we don't have a plan from previous years to learn from. We're developing it on a day-to-day basis. So I think, Teresa, what you're saying today, not having that and things, those things can change next week, next month as vaccines come. I hope that you get a bunch and you're saying, hey, we need some help. We can go to the fairgrounds or the school and inoculate, 300 or 400 people at a time.
Exactly. Anything else?
Teresa, do you think you could send me that article that you're putting in the newspaper?
Sure. I have it on my phone.
That way, because I'm starting to get emails too with people asking, and what I would like to, I think I'll just send them the article. It would be easiest. So.
You bet. I'll do that.
Okay. Thank you.
Okay, thanks, Teresa. Okay, let's see your old business. Public health officer, not here. Public health nurse, you got anything else, Teresa? That's it?
About it.
Anything from board members?
This is Leota. Can you guys hear me?
Go ahead.
Can you hear?
Yes.
Okay. I just wanted to tag on to Teresa's a little bit. We did receive 100 Moderna vaccines yesterday, and those we are going to focus on getting our residents vaccinated and any other staff that have not. At this point, all staff who wanted it have gotten that vaccine from Teresa. So, and like Teresa said, we're going to do some meetings and get together and try and figure out how we can help each other, get the vaccines out to those that want them when we've got them. So.
Thank you.
Leota, I have a question on those 100 doses that you guys are getting in. Do they guarantee you that you'll get the other 100 down the road here for their second dose?
I know we have to report every day what vaccines we give out, and I know that kind of tracks when we will be getting. But yes, if we administer those 100 doses, I believe they automatically send us another 100 when it's time to be able to administer that second dose. It's not something we have to order again.
Oh, good.
it automatically comes, and so our first, second doses start tomorrow, and, we already have them scheduled. They
Okay.
sent us an email, said it was coming, and it was shipped by UPS or FedEx, and, we didn't have to order that. We do physically have to order, the vaccine for first doses every week. So, but the second doses automatically come,
Okay.
so.
Anyone else on the board have anything else? Okay, we need to approve minutes from December 16th, 2020. Is there a motion to approve the minutes?
I was not on the board then, so.
This is Leota. I'll make a motion.
Is there a second?
I'll second it.
Motion been made and second to approve the minutes from December 16th. All in favor?
Aye.
Aye. Opposed, same. Motion carries. Sean, you got any old business?
I don't think I have any old business.
Okay. Hey, Daryl, can we get you to sign these since you were at that meeting? Okay, let's see, new business. Report of Public Health Officer, he's not here. Report from Board of Health members. Election of officers, since we don't have a majority of our board here, I move that I guess someone could move that we delay election of officers until we have a full body.
I would move that we wait on the election of officers until the next Board of Health meeting.
Okay, is there a second?
Second.
Okay, motion's been made and seconded to postpone the election of officers until the next meeting. All in favor?
Aye.
Opposed, same. Motion carries.
When is Robbie back?
What's that?
Robbie, do you know?
He's on deployment, I believe, with the Air Force
Yeah,
Reserve.
yeah.
Yeah, as far as I know, that's where he is. I don't know if he's in Great Falls or where he's at.
I think he's out of the state,
Oh, is he?
I think for maybe a couple months.
So, you don't have anything new to report, Teresa?
No, I don't.
Okay,
I'm sending you all the article and,
okay.
it's going in the paper.
Okay, Sean, 2021 cooperative agreement and Rocky Mountain Supplies holding tank proposal.
Okay, I just looked up Robbie's email and it said until April, by the way.
Oh, wow.
Okay.
Okay.
So the Food and Consumer or the Department of Health and Human Services has sent out their cooperative agreement. That's what the contract in which we do the food inspections and the inspections of trailer parks, RV campgrounds, that type of thing. And so they have sent that out. I had hoped that Helen would have sent that out, but I realized that I didn't get it to her before she left, and then I didn't get it to you. So I did send it to you right before the meeting, and so we'll need to look at it. I think we can probably pick it up again next meeting. It will be fine. But it is just the cooperative agreement. It's just the standard agreement that we use every year between us and the state for doing the inspections. And it is between the Board of Health and the Department of Health and Human Services. So, any questions on that?
Is there a deadline attached to this, or can we wait on it until the next meeting?
Well, let me see. Let me double check because they're usually pretty good about, I mean, they know that the Board of Health has been pretty busy for one thing. I think that, I mean, we just signed the one that for 2020 we did I think we signed it in December or November. So, I mean, it was an amended, but I think we can wait, fine.
Okay.
Fine.
Okay, so we will put off approval of this cooperative agreement until the March meeting, or February meeting, sorry. So then what's the next one? The Rocky Mountain Supply Holding Tank proposal.
Okay, so I've been helping I've been meeting with the consultants that are working on the Rocky Mountain Supply, their new site. And Rocky Mountain Supply would like to be able to accommodate campers coming in and wanting to dump. That type of, well, let me step back. The new Rocky Mountain Supply building and facility will be on a drain field. So it'll be on an on-site wastewater treatment system. And to dump RV waste into that system could create a lot of issues. And so what they are wanting to do is see if they can put a holding tank in, like a 5,000 gallon tank. That tank would then be pumped out, like on Mondays or whatever, whenever it's deemed necessary, and taken either to, it has to be taken to a location that the pump trucks already have approved. One of those locations, it could be the Townsend wastewater treatment plant, which they've already been told that they won't take it. But Helena takes it, or they can land farm it in an approved site. And there are a couple of approved sites throughout the county for that. Most of the pumpers use a kind of land farm situation to spread their waste and till it in. So I told the consultant that I would bring it forward to you for you to bring it forward before they bring an official, waiver request, because our regulations state that that it can only be used for recreational purposes, which then is defined as 120 days out of the year. So I think that we would want to, if you guys were comfortable doing this holding tank scenario, we would have to get a waiver from our rules to allow it. The state, they have to actually get a waiver from the state as well, but the state reviewer that's looking at it and I have talked to with each other, and we both agreed that we would much rather see the waste go into a holding tank and then get pumped and taken away than for it to disrupt the on-site wastewater system serving the actual facility itself. So,
Sean, I have two.
So it's basically just looking for comments. Yeah.
Sean, I have two questions. One is, why were they told no from the wastewater holding site? And two, where else in the county can recreational vehicles dump their waste?
So
I mean, I've had people dump it on the side of our ditch.
Yeah, right. I mean, that's why I always want to promote these types of facilities so that people don't just, I don't know that I've ever actually seen somebody open up their wastewater valve and then drive down the road. I mean, usually it's clean water that you see, but in your mind you're always wondering if it's the clean water or the wastewater. But right now, I believe that the KOA there in Silos, you can dump if you're using their facility, but I don't know that you can pay to do it. Typically the reason that like the city of Townsend or somewhere doesn't want it is for the same reason that we don't want it in the drain field, is that you just don't know what people are putting in those drain fields, in their campers, that then will go into the drain field. So, what they might be putting in some disinfectants that kill everything, or they may just be putting deodorizers in. Blue tablets are typically just deodorizers it smells good. But there are some disinfectants that kill everything, and then you add that to a treatment system somewhere, and people are just reluctant to add that to their facilities without knowing what it is. Did that answer your question?
Yeah.
Where are dump sites in the county at?
Well, there used to be one out at the Roadrunner Trailer Park north of town. I mean, just out by the Townsend Tire.
Oh, I mean, for the
Oh.
RV people, for the people that pump the tank,
Oh.
where do they have that they can dispose of it at?
So there's one that's being approved for the pit stop guy, and I actually have to go look at it this week. I don't know where it is, but it's a pretty good sized area. The locations have to meet very specific criteria, and a lot of them, I mean, all the ones that are in the county now were approved prior to me being here, so I don't know where all those sites are, and I'm not required, like, we don't do an annual inspection of those sites, but typically those, they have to be so many feet from a residence, so many feet from surface water. There can't be high groundwater in the area. There's this kind of very similar to what a drain field would be, but much more stringent in terms of how close they can be to residences and that type of thing. So typically it's in an area with a lot of, surrounded by farmland. And I can find out if that's what you'd like. I just don't know where they are right now.
Okay.
Well, there's not a whole lot of places for people to dump. And, you look at a Sunday afternoon, people coming back from camping and such. I can see why Rocky Mountain, if they have people stopping at their new store to dump, they're going to be buying gas and everything else. I can see why they would look, they'd want to do that. It'd be a nice service that the county really doesn't have.
So
yeah, and that's a way for them to potentially, like you say, it'll generate a little money for them, even if they're not charging for it, just getting people to stop there to buy food and that kind of thing. So
do we need to approve them doing that, or we just need to give them an opinion of which way they should go, and then they need to bring us an actual plan, or bring you an actual plan?
Yeah, they'll have to bring in a deviation request. I just told them that I would, since we were having a Board of Health meeting this week, I told them that I would reach out to, or I would bring it up and see if you guys had any questions or concerns. So, the one thing that I told them that they needed to do was, I would want to see something in writing from one of the septic pumpers telling us that they can do it and that they're willing to do it, but also then that will give me the opportunity to figure out where they would be taking the sewage and disposing of it. If they'd be going to Lewis Park County, or if they'd be land farming it somewhere on a permitted site. So I would, it would give us the opportunity to understand what's actually going to happen.
Okay. I'd be
But
open to it.
There's a lot of counties that absolutely will not do holding tanks. Flathead County, Missoula County, they just are. They have taken that tool out of their toolbox, and I think it's sad, because I think in a situation like this, it is the best thing for this, because we have no idea how much they would be, when people are going to discharge, or how many RVs you're going to get. It's going to be weather dependent. It's going to be weekend dependent. And that's just really hard on a drain field. So.
Okay. Anybody else have any comments? I guess we can go ahead and take a look at it, Sean, and see what happens with it.
Okay. But at this point, no, it's not like a big negative, no big thumbs down at this point, correct?
Okay.
Correct.
Do you have anything else for us, or is that it?
I think that's it.
Okay. Thank you. Anybody else got anything? Comments?
Nope.
Okay, I guess we will adjourn then at 1:50.
Thank you, guys. Thank you, Nicole, for doing that. I appreciate it.
You're welcome.
Thank you, Sean.